Welcome to Eye Contact, a video news programme on issues and controversies in ophthalmology, sponsored by EUROTIMES. I'm Peter Barry, and we're here at the 19th ESCRS Winter Meeting in Istanbul. Today we'll be talking about phaco tricks that can improve your cataract surgery with Khiun Tjia from the Izala Clinic in Zwolle in the Netherlands. Khiun, you're very welcome. You're an experienced surgeon and a well-known teacher. Cataract surgery, and particularly phacoemulsification, continues to evolve with equipment and with techniques. Can I ask, what are some of the first things that you suggest to your students to improve their techniques?
Yes, Peter. The very first thing I would advise them is to get a kind of basic insight of what a phaco machine does, and so that they have a certain basic expertise on ultrasound and fluid dynamics, which very heavily are involved with the phaco surgery and determine to some extent the outcome of the cataract surgery. Just a brief example, vacuum settings can help but also totally deteriorate surgery. When vacuum is too high, or occlusion, break, surge, too much fluid is pulled out of the eye, posterior capsule comes up, and big complication occurs. And also, for instance, they should learn the influence of air in the aspiration line. All of that can be looked up on the iLearn program on a basic phaco course.
And do you encourage your students to change the settings, or do they just utilize the settings that are in the machine according to the manufacturer?
Yeah, well, normally they just use what is set up for them, hopefully by someone with some knowledge. So they should understand and follow those courses in order to be on the safe side, at least regarding settings.
And in your experience, what are the common mistakes that you observe, the beginners repeatedly make?
Yeah, well, beginners are always tense. They're nervous and they focus on what is happening looking through the microscope. However, everything in phaco surgery is dependent on control, visualization, and control over everything you do. So beginners don't pay enough attention to how they sit. They get tension in their body. They kind of lift their arms, sometimes support their hand with stretched fingers, which induces tension, muscle tension in their hands, which results in jerky, uncontrolled movements. So they should pay much more attention to ergonomics. Relaxed position, good position behind the microscope, and especially good position of the hands.
And good position, presumably, of the arms. So if you minimize tremor by stabilizing all the joints as far as the wrists.
Absolutely, yes. And trying to avoid, a lot of tension. It invariably occurs when you are nervous, unfortunately.
When you, the instructor, are nervous, or where the trainee is nervous, or both?
I am, because of my long-term experience, not so nervous anymore, but that can increase when you see things not going the right direction, I must admit.
So presumably you as a trainer make a concerted effort that your trainees don't repeat the same mistakes with ever increasing confidence and call it experience.
Absolutely, yeah. So the modern way of teaching and learning is to evaluate afterwards in a calm setting, and focus on the things which went well and the things which should be improved.
Do you encourage your trainees to video their surgery and watch it in the privacy of their own home?
Absolutely, that is the key to improvement. Actually, they have no clue what they're doing during surgery.
Yes, and if they can be embarrassed at home with an audience of one, it's a salutary teaching exercise.
Yes.
Do you find with trainees that once the phaco component of the procedure is completed, they think they've crossed the major hurdle and excessively relax for irrigation aspiration? Do you have particular tips for them to control irrigation and aspiration?
Yes, well, in my particular own setting, we use bimanual irrigation aspiration, and with smooth aspiration port openings, which tremendously helps reducing the complication rate. But I do focus as much on irrigation aspiration as I do on the ultrasound part.
You mentioned at the beginning that you are watching for something like air in the aspiration line, which obviously completely upsets all of the aspiration pressure. Do you physically make the student test the phaco machine in the test chamber prior to putting it into every eye, and to do the same thing with the IA?
Not exactly. I try to make them very aware of the potential presence of air, and if so, get rid of air at all times prior to reintroducing the instrument into the eye. And that I do by showing these gruesome videos which have a heavy impact onto the brain.
And the last question I think I'd ask you, as an experienced teacher, are you surprised by how easily today's young surgeons learn phaco, and how relatively low their complication rate is in the learning curve with a good teacher?
Well, you just hit on the key part, the good teacher. And of course, all these modern course programs, online, virtual simulators help tremendously. And there's so much more out there nowadays to help shorten the learning curve as opposed when we started.
Absolutely. Well, thank you very much, and thank you for joining us. For more information on this and related topics, please visit us at eurotimes.org. Thank you all.
Thank you.